morning. The bibliographic references and the publisher's source article are accessible in the description under the video. If you want to support the dissemination of scientific knowledge, subscribe. And can you give it a thumbs up, please? Abstract. The advent of the Internet has facilitated a dramatic increase in the number of individuals accessing and possessing child pornography, and a corresponding increase in referrals for assessment and treatment. Questions remain regarding whether child pornography possessors are more similar to or different from other types of sex offenders, and whether or not assessment and treatment protocols for contact and non-contact sex offenders are appropriately applied to child porn offenders. The present study compared 50 child pornography offenders, 45 non-contact sex offenders, and 101 contact child molesters. Results indicated that the three groups were more similar than different. However, child pornography offenders were distinguished by greater academic and vocational achievement, fewer childhood behavior problems, and by select relational variables. Recidivism rates were low for all groups. Introduction. Child sexual exploitation has thrived in the unregulated cyberspace environment. Convictions for accessing, distributing, and producing child pornography increased 1,404% between 1996 and 2007. The Internet has given impetus to child pornography due to its anonymity, accessibility, and affordability. Individuals are now able to access and distribute child pornography from the comfort of their own homes in privacy and with relatively little risk of detection. It has been estimated that child pornography is a billion-dollar industry worldwide. In 2003, the number of unique images of child abuse circulating on the Internet was estimated at approximately 1 million, with this number increasing by 200 every day. However, due to the size and mercurial nature of the Internet, it is difficult to assess how much child pornography actually exists online. The resulting influx of child pornography offenders within the justice system has challenged evaluators, treatment providers and justice officials to arrive at determinations regarding how to assess, treat, and manage this previously infrequent division of sexual offenders. No evidence-based protocols are currently available to guide the assessment and management of child pornography offenders, although Wakeling, Howard, and Barnett's preliminary work suggests modified actuarial measures may have some predictive utility. In lieu of established protocols for assessment and treatment, clinicians working with child pornography offenders have been forced to rely on protocols designed for and validated on non-Internet-based sex offenders. The justifiability and wisdom of generalizing existing assessment and treatment protocols is dependent on the degree to which child pornography offenders resemble non-Internet-based offenders in terms of clinical and risk-related characteristics. A current issue being debated by clinicians is whether child pornography offenders belong to a separate group of sex offenders or to a previously categorized one, namely child molesters, who are merely using a new technology to carry out their offenses. Early research efforts aimed at comparing and contrasting child pornography offenders with sex offenders who have committed hands-on offences against children have identified both similarities and differences between child pornography offenders and child molesters. The emerging evidence suggests that child pornography offenders may be distinguishable from child molesters on the basis of intimacy deficits and degree of social isolation. Webb, Crisati, and Keene investigated psychological and socio-affective differences between child pornography offenders and child molesters. In addition to finding that child pornography offenders were significantly younger, they found that they were more likely to have sought out mental health services as an adult, and they also had significantly fewer cohabitating relationships with intimate partners. Similarly, Bates and Metcalf found that child pornography offenders reported higher levels of emotional loneliness and contact offenders. Child pornography offenders have been purported to be more sexually deviant than child molesters. For example, child pornography offenders have been shown to have more problems with sexual self-regulation, be more likely to demonstrate pedophilic sexual interests, and be more likely to self-report being sexually attracted to prepubescent and adolescent children. These findings support the results of CETO's earlier study in which child pornography possession was found to be a stronger indicator of a pedophilic sexual arousal than a history of committing an actual contact offence against a child. Kruger, Kaplan, and First did not find differences in diagnosis of pedophilia between child pornography possessors and men arrested for attempting to meet a child, but other significant differences were found, indicating that child pornography possessors were more likely diagnosed with pornography dependence, but less likely with cybersexual dependence. An explanation for this may be that the Internet allows access to a very wide range of sexual media, and individuals are likely to select their pornography congruent with their preferred sexual interests, while offline sex offenders may be choosing victims based on convenience, or they may be less discerning with whom they pursue sexual gratification. A meta-analytic study reported similar findings, but proposed that the reason why they possess significantly higher sexual deviancy is the result of police activities unintentionally biasing results. It may be the case that police only proceed with investigating egregious incidents of child pornography use or offenders who have large volumes of child pornography due to limited police resources, and thus only the most sexually deviant become charged and assessed. Again, more research is needed to verify the validity of this finding. Elliott, Beach, Mandeville-Norden, and Hayes found that relative to the child molesters in their sample, child pornography offenders exhibited lower levels of traits associated with poor behavioral controls and criminal inclination. Specifically, child pornography offenders were found to be less impulsive, had a poorer capacity for making rapid decisions, and were less likely to react over-assertively. Additionally, child molesters have been described as exhibiting higher levels of psychopathy, as indicated by scores on the psychopathy checklist, screening version than child pornography offenders, as well as more antisocial characteristics relating to breaking social rules, attitudes towards sexual assault, and acting out. Child pornography offenders also appear to differ from child molesters in terms of victim empathy, offense-supportive attitudes, and cognitive distortions. Research suggests that child molesters are significantly more likely to have an external locus of control, suggesting that contact offenders may subjectively perceive less self-control over their behaviour and may be more likely to attribute their behaviour and its consequences to external forces. Babkishin and Bates and Metcalf reported that child pornography offenders have relatively higher levels of victim empathy coupled with fewer cognitive distortions. Elliott suggests that contact offenders may have more deficits in the antisocial cognitions pathway as evidenced by their greater number of cognitive and victim empathy distortions. These results may indicate that child pornography offenders are less likely to hold maladaptive beliefs relating to child sexuality. It may also suggest that child pornography offenders are less likely than child molesters to commit a contact offence against a child in the future or become a repeat offender. However, the results of a previous study indicate that child pornography offenders were actually more likely to endorse cognitive distortions that children are sexual beings and willing to engage in sex with an adult. The authors explained this result by suggesting that child pornography offenders fuel their fantasies during masturbation with deviant sexual thoughts about children founded on cognitive distortions about their sexual maturity and behaviour. The question of whether or not child pornography possessors are likely to progress to committing contact offences against children is an important one. The emerging evidence indicates that although child pornography offenders are more likely to harbour paedophilic sexual interests than child molesters, their tendency to be less criminally inclined and in possession of relatively better behavioural controls contribute to a lower likelihood of committing contact offences and to lower recidivism rates in general. Eeg, Sito, and Williams found that over an average follow-up period of 6 years only 6% of child pornography offenders incurred a criminal charge for a contact sexual offence. Child pornography offenders who had a previous contact sexual offence were more likely to re-offend in any capacity, sexually or non-sexually, while offenders with only child pornography charges were much less likely to incur any new offences. Another study reported that none of the child pornography offenders in the researchers' sample were charged with commission of a contact sexual offences during the 18-month-long follow-up period. In comparison, 13% of the child molesters in Hansen and Morton Bergen's study went on to commit another sexual offence during a similar time period. The apparent disparity between the risk of re-offending for child molesters and child pornography offenders may reflect integral differences in their etiology and motivations for offending. Despite the growing accumulation of information regarding the similarities and differences between child pornography possessors and child molesters, only one single study has compared and contrasted child pornography offenders with offenders who commit non-contact offences. Sito, Wood, Babkishan, and Flynn compared child pornography offenders with two groups: low-risk child molesters and online solicitation offenders with low prior history of contact offending. They found that child pornography and solicitation offenders, both non-contact, were more likely to never have lived with a lover than child molesters contact, and that solicitation offenders were more likely to report pedophilic interests compared to the other groups. The differences were purported by the authors to be meaningful and suggest considerations should be made with regard to supervision and treatment. Because child pornography offences involve no direct physical contact with a victim, it may be of clinical and theoretical importance to determine if these offenders bear more similarity to other types of non-contact sexual offenders, specifically those seen under the spectrum of courtship disorders. It is plausible that previously described social and relational deficits observed in groups of child pornography offenders and solicitation offenders may influence them to offend in an indirect manner similar to voyeurs and exhibitionists. Child pornography offenders have been noted to exhibit features that have been often observed among voyeurs and exhibitionists, and include greater psychological problems, lower levels of happiness and satisfaction, increased substance abuse, greater use of pornography, increased sexual activity, frequent masturbation, and greater sexual deviancy. Compared to offenders who seek out physical contact with a child, child pornography offenders may be sexually excited by the voyeuristic nature of viewing pornography, encouraged by the false sense of security while masturbating and fantasizing at home, and comforted by the maladaptive belief that they are not physically hurting a child. To date, there is still much to be known about the similarities and differences between child pornography offenders and non-contact sex offenders. Aim of the current research: the present study compares and contrasts child pornography offenders with both child molesters and with non-contact sexual offenders. The aim of this research is to explore whether child pornography offenders are, as a group, qualitatively distinct from groups of non-contact offenders and contact offenders in terms of their academic, vocational, social, psychological, and criminal histories. Methods: a sample of 196 male sexual offenders were referred and or court-mandated for an assessment of their risk and treatment needs between 2000 and 2009 and received formal convictions for their sexual offences. They were either receiving services prior to or following the receipt of their sentence/disposition. The mean age of the sample was 37. 1 year's standard deviation equals 14. 17. 50 offenders were convicted of accessing and or distributing child pornography. 45 offenders were convicted of non-contact offences that included either exhibitionism or voyeurism, and 101 offenders were convicted of child molestation. To ensure that the groups were distinct, the criminal histories of the participants were coded directly from official criminal records to determine the appropriate grouping. Any offenders who had past offences that overlapped with the other two categories were excluded from the analyses. Similar procedures have been observed in other comparative studies. Chi, Sito, 2012. Demographic characteristics for each group are listed in Table 1. Measures historical variables related to education and employment, social, sexual and criminal behavior, mental health, substance abuse, personality inventory scale scores, and recidivism data were also coded. Offender characteristics. 7 demographic variables were examined. Type of data is noted in parentheses. Age at the time of the index events continuous, B developmental, childhood, and adolescent history, which examines whether there were any behavioural problems prior to age 18, dichotomously scored as absent versus present. See academic achievement and behaviour, which looks at achievement and maladjustment in school history of suspension/expulsion, failed grade, poor school adjustment, and completion of post-secondary, were dichotomously scored as absent versus present, and years of education recorded as a continuous variable, de-employment information at the time of the index offence dichotomously scored with history of being fired versus not applicable, and highly skilled versus labor-type work, asexual and relationship history dichotomously scored as daily masturbation versus not, single versus not single status, and continuous variables of age at first masturbatory experience, age at first consensual sex, number of partners, number of children, treatment history, past receipt of mental health services, prior sex offender treatment and successful completion were dichotomously scored as absent versus present, and substance abuse history dichotomously scored with presence versus absence of teenage alcoholism, marijuana, lysergic acid diethylamide, and cocaine use, alcohol use and drug use until index offence. Personality Assessment Inventory. The Personality Assessment Inventory is a self-report questionnaire with 344 items measuring personality characteristics at a most relevant in a clinical setting. 11 clinical scales that include borderline features, antisocial features, alcohol problems, drug problems, aggression, suicidal ideation, stress, non-support, treatment rejection, dominance and warmth were included with the T-scores used in the analyses. The 3 subscales of the antisocial features scale were included at behaviors, egocentricity, and stimulus seeking, criminal history items and risk assessment score. Variables representing aspects of past offending were analyzed to investigate between groups differences in criminal history. For the purpose of the current study, 4 continuous variables, age at first conviction, prior number of convictions, prior number of violent convictions, and prior number of sex offence convictions, along with 3 categorical variables, prior non-sexual violence conviction absent versus present, prior sexual charges and / or convictions none versus 1 versus 2+, and prior sentencing dates 3 or less versus 4 or more, were included in the analyses. The latter 3 categorical variables were taken from the static 99. An overall risk score was calculated for each offender based on the static 99 and included in our comparison analyses. The static 99 is a risk assessment tool for sexual offenders that determines the level of risk they pose to the community through possible reoffending. It is a 10-item form that bases the estimation of risk on only static variables which have been empirically established to be associated with sexual recidivism, and includes offender age at release, ever lived with a lover for at least 2 years, any non-sexual violent index conviction, any prior non-sexual violent conviction, number of prior charges or convictions for sexual offences, prior sentencing dates, any convictions for non-contact sex offences, any unrelated sexual victims, any stranger sexual victims, and any male sexual victims. A modified static 99 total that excluded the last 4 variables related to victims and contact offending was calculated i.e. modified static 99 total score included 6 of the 10 items. Like the CETO 2012 paper, we excluded the 3 victim items: any unrelated sexual victims, any stranger sexual victims, any male sexual victims. In addition, we excluded the item any convictions for non-contact sex offences, as we had already selected our groups by during non-contact groups have no prior contact offending in their history, and inclusion would artificially increase the change of significant differences that were not meaningful. Recidivism. In order to accurately assess recidivism, offenders were only included in the analysis if the follow-up period was longer than 2 years to allow for a minimal amount of time post-release. Data from criminal records, received from the Canadian Police Information Centre and the Provincial Correctional Management Information System, was analysed to determine the number of new convictions, be whether incarceration, probation, or fines levied at sentencing, c the date and type of any first new sexual offence, d whether any of the new sexual offences match the type of the previous index sexual offence. Procedure. Files to an outpatient forensic clinic were searched for sex offenders' files, Kents. Research participants were not solicited for this study. The region where the research was conducted abides by legislation, which sets out rules that respect the use and disclosure of health information for research purposes. The present research was reviewed by a Research Ethics Board who has been designated to review research proposals addressing the use and disclosure of health information, and it was deemed unreasonable and impractical to obtain consent directly from offenders, since they no longer were receiving services from the institution. Therefore, consent was waived for the purposes of conducting this research. The case files that were reviewed contained assessment reports, criminal records, case notes, offenders' reports, demographic information, and some description of victim information. Files were coded retrospectively, and no additional measures were administered for the purpose of the research. Because not all variables were available in the files for all offenders, sample sizes varied depending on the analysis. The present study is part of a larger database in which 406 variables were coded from the case files on each offender. To ensure we would maintain strong inter-rater reliability, 4 research assistants received a full day of training on the variables and were examined on 3 cases to ensure they reliably coded the variables. Subsequently, 5 offenders' case files were coded independently by 2 raters. For a majority of the variables included in this research i.e., no calculations were conducted when assistants did not code a variable on more than 2 of the 5 files. This only applied to 9 of the 40 variables. Categorical variables were examined using percentage agreements and kappa statistics. 20 variables had 60% to 100% agreement between coders with kappa values ranging from 0.20 to 0.67. 4 variables had an agreement of less than 60% and included whether the offender was suspended from school, ever fired from a job, accessed mental health services, and ever used drugs before the index offence kappas ranged from 0.12 to 0.38. 7 variables are continuous. Correlations were calculated, although based on a very small sample size, and ranged from 0.42 to 0.99. Only 1 variable performed poorly, number of children, in terms of reliability. Reasons that accounted for some of these differences between raters was the time that the coding was completed. For example, research assistants with the same files at several months apart and the files, when active, included additional information not available at the time of the first coding. Results: to compare child pornography offenders with child molesters and non-contact sexual offenders, chi-square tests were used to test categorical variables and two-tailed analyses of variance were used to examine continuous variables. Significant main effects were examined by post hoc analysis using the Bonferroni procedure. Due to the compounded effect of a limited sample size and missing data, numerous variables were excluded from the analyses as the assumptions of the statistical tests were not met. Inferential statistics were conducted on demographic variables, development and historical variables, criminal histories, psychometric testing results, and recidivism, using an alpha of 0.05. Education and work history. The 3 sex offender groups were compared on variables related to their age, school behavior, and academic achievement. Refer to Tables 1 and 2 for descriptive information and inferential analyses. The analyses revealed that the 3 sex offender groups were equivalent in terms of their overall age at the time of their assessment, elementary school maladjustment, childhood aggression, childhood peer rejection, and history of being fired from a job, all PS superior to 0.05. However, the samples displayed significant variability in terms of their histories for suspension/expulsion from school, grade failure, school adjustment, completion of post-secondary education, and occupational skill level. Fewer child pornography offenders reported being suspended or expelled during their years at school than non-contact offenders and child molestation offenders. Separate post-hoc, chi-square analyses revealed that child pornography offenders significantly differed from both non-contact offenders, chi-square equals 6, 7, p inferior to 0.01, and child molesters, chi-square equals 7, 7, p inferior to 0.01 on this variable. Less than a quarter of child pornography offenders had ever failed or been held back a grade, which was less than the child molesters, chi-square equals 7, 7, p inferior to 0.01, but no different from the non-contact offenders. Poor school adjustment, as evidenced by serious behavior or attendance problems, was also identified in 1/3 of child pornography offenders, but in more than half of non-contact and child molestation offenders. Post hoc chi-square analyses indicated for the elementary school adjustment of child pornography offenders was similar to that of non-contact offenders, but was statistically better than the school adjustment of child molesters, chi-square equals 7, 1, p inferior to 0, 0.5. Child pornography offenders, on average, completed 2 more years of school than both non-contact offenders, T82 equals 2, 93. P inferior to 0, 0.1, and child molestation offenders, T142 equals 5, 0.6. P inferior to 0, 0.01, with no difference between the latter two groups. Child pornography offenders were also found 3 to 4 times more likely to have attended post-secondary than both non-contact offenders, chi-square equals 8, 0, p inferior to 0, 0.1, and child molesters, chi-square equals 22, 0, p inferior to 0, 0.01. Regarding employment at the time of the index offence, child pornography offenders were twice as likely to be engaged in skilled employment than were non-contact offenders, chi-square equals 5, 1, p inferior to 0, 0.5, and child molesters, chi-square equals 7, 1, p inferior to 0, 0.1. Further chi-square analyses revealed that these pairwise comparisons were statistically significant. For all of the significant findings above, non-contact offenders did not differ from child molestation offenders on any of these variables. Sexual and relationship history. The 3 samples were compared on their sexual histories and current relationship statuses. Descriptive statistics are presented in Table 1 for continuous variables and in Table 2 for categorical variables. The 3 groups demonstrated no significant variability in lifetime, total number of marriages, but there were differences in the percentage of offenders in each group who were married at the time of the index offence. More 68% child pornography offenders were single at the time of the index offence than non-contact offenders 50%, chi-square equals 4, 1, p inferior to 0, 0.5, and child molesters offenders 43%, chi-square equals 10, 6, p inferior to 0, 0.1. The percentage of non-contact offenders and child molesters who were single when they committed their index offence did not differ. Furthermore, significant variability was observed between groups with regard to average number of biological children. Post hoc analyses revealed that child pornography offenders had significantly fewer biological children than both non-contact offenders, T83 equals 2, 48. P inferior to 0, 0.5, and child molesters, T137 equals 2, 97. P inferior to 0, 0.1. No difference was found between non-contact and child molestation offenders. No between groups differences were observed in relation to variables representing onset i.e., age at first masturbation experience and at first consensual sex and frequency of sexual behavior i.e., number of sexual partners, daily masturbation, mental health. The 3 sex offender groups were compared on their degrees of contact with mental health services and whether or not they had received any form of treatment prior to their offences. The analysis revealed that the samples did not differ on whether they accessed mental health services, received prior sex offender treatment, and successfully completed treatment. The 3 groups were compared on 11 selected psychopathology and personality scales of the Personality Assessment Inventory. The analysis revealed no differences on 10 of the 11 scales. Child pornography offenders demonstrated lower scores than child molesters, T68 equals 2, 92. P inferior to 0, 0.1 on the warmth scale, which represents the degree to which one is supportive and nurturing. Non-contact offenders did not differ from the other 2 samples in their levels of warmth. When the subscales of the antisocial features scale were examined, it was found that non-contact offenders generated significantly higher scores than child molestation offenders, T59 equals 2, 26, P inferior to 0, 0.5, on the antisocial egocentricity scale, but child pornography offenders did not differ significantly from either comparison group. No differences were noted on the antisocial behavior and antisocial stimulus-seeking scales. Substance abuse history, when compared on the basis of drug and alcohol histories and current usage, analyses revealed that the samples did not differ in prevalence of teenage alcoholism, marijuana use, or lysergic acid diethylamide use. They did differ in their past use of cocaine, with more non-contact offenders had a history of using cocaine than either child pornography, chi-square equals 5, 4, p inferior to 0, 0.5, or child molestation offenders, chi-square equals 4, 3, p inferior to 0, 0.5. No significant variation was found between child pornography and child molestation offenders in terms of their cocaine usage, although the samples did not differ in their use of alcohol around the time preceding the index offence. Non-contact offenders were more likely than child pornography and child molesters to have used drugs, as shown in the pairwise comparisons between non-contact offenders and child pornography offenders, chi-square equals 5, 3, p inferior to 0, 0.5, and non-contact and child molestation offenders, chi-square equals 6, 5, p inferior to 0, 0.5. Criminal history. The groups were compared on criminal history items, and percentages, frequencies, and chi-squares are listed in Table 5. The analysis revealed that no differences were found among the groups in terms of their age at first conviction, and the number of prior convictions, prior sexual offence convictions, prior non-sexual offence convictions, and prior sexual offence charges. Significant variation was found for only 2 variables. Analyses revealed that non-contact offenders had higher numbers of violent convictions than both child pornography offenders, T80 equals 3, 0, p inferior to 0, 0.1. No difference was found between child pornography and child molestation offenders, or non-contact and child molestation offenders. Regarding the total number of prior sentencing dates, post hoc chi-square analyses revealed that child pornography offenders had fewer prior sentencing dates than non-contact offenders, chi-square equals 6, 41, p inferior to 0, 0.5, but no differences emerged between child molestation offenders and the other 2 groups. Statistical significance was found among the groups using the modified static 99 total. However, the effect size is extremely small. Non-contact offenders scored higher than child pornography offenders, T79 equals 2, 39, p inferior to 0, 0.5, but there were no differences between child molestation offenders and either the child pornography or non-contact offenders. Recidivism. The 3 offender groups were compared on the number and types of new offences to determine recidivism rates and the severity of any newly acquired convictions. Percentages, frequencies, and chi-squares of the analyses are listed in Table 6. Low observed recidivism rates prevented statistical analyses from being conducted to determine whether there were any significant differences between the 3 samples on specific types of recidivism, e.g., sexual, violent. 11% of child pornography offenders, 18% of non-contact offenders, and 14% of child molestation offenders went on to commit a new offence of any kind. Concerning sexual recidivism, 7% of child pornography offenders, 5% of non-contact offenders, and 5% of child molestation offenders incurred a new sexual conviction after their index offence. For all of the offenders, the new sexual offences matched their index offences, while various other convictions that were non-sexual and non-violent were committed in low numbers by each sexual offender group. Child molestation offenders were the only category to commit a new violent offence, 3%. With the small base rate, the length of time between the date of release and the date of the new offence was examined, and no differences emerged among the child pornography offenders. Mean equals 13, 5 months. Standard deviation equals 17, 27. Range equals 1 to 43. Non-contact offenders mean equals 23, 7. Standard deviation equals 16, 59. Range equals less than 1 to 44. And child molestation offenders mean equals 17, 9. Standard deviation equals 12, 53. Range equals 2 to 44. F226 equals 0, 76. NS. Discussion. On the whole, comparisons between child pornography possessors, non-contact sex offenders, and child molesters revealed that the three sex offender groups were largely similar to one another on the basis of personality traits, mental status, psychiatric history, intimate relationships, sexual and criminal history. Between group differences that were identified fell within the realm of academic achievement and elementary school behavior, and to a lesser extent, among variables that are indirectly related to interpersonal functioning. Consistent with past research by Bates and Metcalf and Indras, child pornography offenders completed, on average, 3 more years of schooling, and the other two sex offender groups were less likely to have failed a grade or been suspended or expelled, and more likely to have gone on to receive post-secondary education. Results from past studies that found child pornography offenders to have greater rates of employment than child molesters were not replicated by our data. Child pornography offenders were, however, more likely to have been employed in a skilled labour position at the time that their index offences were committed, a finding that may be consistent with observed distinctions in terms of superior educational achievement. Also, although previous research has suggested that child pornography offenders have more sexual self-regulation problems than child molesters, those results were not replicated in the current study. The 3 groups in our study did not differ in terms of onset of masturbation, age at first consensual sexual experience, or total number of self-reported sexual partners. Although nearly twice as many child molesters reported masturbating on a daily basis as child pornography offenders, 67% versus 35%, self-reported frequency of masturbation were not statistically different between groups, a fact that may be attributable to lack of statistical power due small sample size. Between group comparisons on variables associated with the presence or absence of intimate relationships yielded somewhat mixed results. All 3 groups were equally likely to have been in a cohabitating relationship in the past, and the groups did not differ in terms of number of marital relationships in the offender's lifetime. However, the finding that child pornography offenders have fewer biological children and that they are more likely single at the time of their offence may lend support to previous research findings that child pornography offenders report more emotional loneliness than child molestation offenders and are less likely than child molesters who have lived with their partners. Although speculative, these results raise questions regarding whether or not the low rates of contact sex offences against children observed among samples of child pornography possessors might be at least partially attributable to lack of direct or immediate access to potential child victims. Regarding psychiatric history and self-reported personality characteristics and mental health variables, all 3 offender groups were clinically unremarkable and largely indistinguishable from each other. They were equally likely to have accessed mental health services in the past, with approximately 1/3 to a half of each group having done so. Groups did not differ on 12 of the 14 clinical scales generated by each offender's self-report on the personality assessment inventory, and average group scores for all groups on all 14 of the personality assessment inventory clinical scales fell within the clinically insignificant range. Level of egocentricity differentiated non-contact offenders from the other 2 groups, and child molesters described themselves as having greater interpersonal warmth than either of the other 2 groups. This latter finding is consistent with the previously mentioned research claiming child pornography offenders report higher levels of emotional loneliness and are more likely to be single. It is possible that child pornography offenders report less interpersonal warmth not due to an overall dislike for interpersonal relationships, but rather because their lack of social skills makes the experience of close interpersonal relationships discomforting and anxiety-provoking. This, in turn, may result in decreased desire and motivation to maintain close relationships. With regards to substance use histories, non-contact offenders were more likely to have used drugs as a youth and as an adult, and specifically, used cocaine. Child pornography and child molestation offenders had more similarity in their illicit drug use than either group did to non-contact offenders. Previous research looking at substance abuse in a sample of exhibitionists comparably found that 1/3 displayed patterns of drug abuse. Others have speculated that this elevated rate of drug use among non-contact offenders may be reflective of lower socio-economic status, delays in school, pleasure-seeking tendencies, and poor family relationships. It is suggested here that elevated levels of drug abuse among non-contact offenders might be suggestive of self-regulation and impulse control difficulties. When factors associated with criminal history were examined, very few differences emerged between child pornography offenders and child molesters. Similarly, an analysis of the recidivism rates supports past research indicating a very small number of child pornography offenders are convicted of further sexual offences. Although other research has noted that recidivism rates of child molesters appear to be higher than recidivism rates of child pornography offenders, our study does not offer support for this conclusion. However, our base rates overall may be low and the time for follow-up may be too short. Interestingly, the small number of offenders who recidivated subsequently committed crimes that matched their group assignment based on their index offence. This finding suggests, albeit with limited data, that despite similarities across the groups on other variables, there may be some specialisation of offending. In summary, it may be surmised from these results that non-contact offenders are not significantly dissimilar to child molestation offenders, and that child pornography offenders diverge equally from both contact and non-contact sexual offenders. Previous research has shown that a child pornography offence is more indicative of paedophilia than is for a conviction of child molestation. It is possible that this child pornography sample captured the qualities of individuals with paedophilic interests, and by deselecting those child pornography offenders who did have contact offences in their criminal histories, this study has potentially highlighted the narrow population of offenders who are sexually aroused by children but have not offended against them. One may theorize that child pornography offenders have higher levels of internal inhibition, as they were less likely to have used drugs, more likely to complete post-secondary schooling, and more likely to procure a skilled occupation. They also demonstrated characteristics that would increase external inhibitions and decrease ability to overcome the resistance of a child. Based on the lower numbers of biological children and greater likelihood of being single, child pornography offenders were less likely to be in close proximity with a child. Lack of proper communication skills and few social relationships may increase the likelihood for such offenders to carry out online offending. Although child pornography offenders have high rates of pedophilic sexual interests, the characteristics of the child pornography offenders found in this study may sufficiently circumscribe their sexual arousal and inhibit them from acting on it. Consonant with Finkelher's precondition theory 1984 that proposes 4 conditions are necessary before a sexual offence against a child can occur, namely, sexual motivation, lack of internal inhibitions, lack of external inhibitions, and lack of resistance from the child. The absence of at least 2 of these conditions may reduce the likelihood of child pornography offenders from committing a sexual transgression against a child victim. Since child pornography offenders have greater internal and external inhibitions, the lower their risk of a contact offence, it is reasonable to conclude that they would benefit more from treatment tailored to maintaining these inhibitions and decreasing their unique characteristics of emotional loneliness and interpersonal difficulties. The current practice of treating these offenders alongside child molestation offenders who do not have these inhibitions may be inefficient, as time is wasted teaching child pornography offenders basic skills they may already possess. Their unique characteristics may necessitate more advanced education and training for them during treatment, and perhaps these are best guided with appropriate theoretical models in press. In addition, the goal of preventing child pornography offenders from reoffending and, ultimately, never incurring a contact offence may be more effective if judicial officials focused on sentencing decisions that maintained the natural inhibitions in child pornography offenders, such as their employment, sobriety, and lack of contact with children. Unfortunately, a recent study suggests that the judiciary does not always include such external inhibitors in their sentencing. Jung and Stein, 2012. This study considers theories beyond aggregating child pornography offenders with child molestation offenders. Although the findings contribute to the empirical literature and increase our understanding of child pornography offenders, the effect sizes reported here are relatively small, and replication of our findings would be recommended with larger samples and longer follow-up times. Another limitation is the small number of voyeurs included in our sample of non-contact offenders. This was particularly limiting, as a comparison between child pornography offenders and voyeurs would have been more logical than with exhibitionists. Typical of sex offender research is the sole inclusion of offenders who have come into contact with the justice system. Data on offenders who have not been charged is difficult to attain, yet could possibly be very important in understanding these offenders, as they may represent vastly differing characteristics. Although our study did not include offenders with mixed offences due to the small number of mixed offenders, it would be important to establish whether there are any differences between child pornography offenders who have had contact offences against children and child pornography offenders with no contact offences, and would provide insight into variables that may lead to contact offending. Another direction of inquiry may be to clarify the role that pedophilia plays in viewing child pornography. One previous study has established the groundwork that child pornography offenders have elevated rates of pedophilic tendencies, but the influence these tendencies have on etiology, risk, and recidivism remains unclear. In conclusion, this study investigated whether child pornography offenders fall on the spectrum of contact and / or non-contact sexual offenders. While results from this study provide evidence for elementary similarities among child pornography, non-contact, and child molestation offenders, significant differences imply that child pornography offenders do possess integral differences from both sex offender groups. These differences lie mainly in child pornography offenders' greater levels of educational success and higher levels of inhibitions that may explain their choice to proceed with online offences versus contact offences. Based on previous theoretical paradigms regarding the pathway towards contact offending, it would appear that child pornography offenders who have no history of contact offences are at minimal risk for progressing onto becoming child molestation offenders. Preliminary results from this study would suggest that child pornography offenders do not fit perfectly into the clinical molds of contact or non-contact sex offenders. Further research is needed to verify the extent of the differences and similarities, and the future direction that assessment, treatment, and sentencing for child pornography offenders should advance.